hitting all the spots I've ever wanted to be hit.
Right there.
Oof. I gotta get you a cute clapper.
And action.
Oh.
Yeah. So when they sync the audio and the video.
Is that what that's for?
Yeah. So that when, because I do audio protection too. So you clap it, and then when you're syncing the audio and the video in like Adobe Premiere, you can right click and just sync, and then it syncs to the high part of the sound. But you can also see it. So like if the sound's out or whatever, you click. Yeah.
Cool.
I'm sorry. I'm a big nerd. I'm so sorry I interrupted you.
No, I don't care.
I'm so sorry.
No, we're like. No, that's
I'm
like
always down to
that's
help
the
you.
other part of my brain. So we got jaw,
Mm-hmm.
and then you just this from being
From
tight.
yeah, I work a desk job, so it's just super, super, super tight.
Do you want a head to toe adjustment
That
as
would be
well?
great. Yeah.
Okay, I'll work. I'll do like my regular stuff that I do, and then we'll end usually with the jaw.
Okay.
Only because when you're on your face right here, I don't like the pressure can undo some of that.
Okay.
The pressure. So I usually end with the jaw.
Sure.
Just so that you know what we're doing here. All right, so what I usually do is feel your neck, feel the spine, and we go from there. Just know that we...
At the end of the day, I'm still a popper.
At the end of the day, it's still the go. Make the noise.
Make the noise.
Make the noise. So joints live in this little space. We call it joint play. You take it very briefly past that, and you come back to this region again. You don't want to go too far over here. You rip it. So you'll feel me feel the joint, and I'll move it around, and then I'll click it like that. That's literally what I'm doing.
Oh.
So I'm living in this space here. We flick it in that space. That's all this is. So I'm never really taking you to that point where it breaks, because I only measure it. Now it is very archaic, and you're relying on the skill of the practitioner to do this. There's no way I can measure that with a machine.
Mm-hmm.
It's all done by feel. So that's where the skill of the physician comes in. Yes, we're physicians. The doctor comes in because we got a feel for this. And you'll see me test it. I err on the side of caution.
Mm-hmm.
I underscore it first, and then I might go a little deeper if I think you can handle it. Ooh, super tight over here. You have a little one up here.
I do suffer from migraines
give you
all
headaches,
the time,
yes.
but
And I was like,
I've
this
had
one's
them
a
my
headache.
entire life. I've always had migraines.
Yeah, well, let's see if we can't, soften that one. Okay, this one's the one that gives you migraines, right there.
Oh my gosh,
Yeah,
I didn't
that
even
one. Yeah, you feel
I
it
didn't
in
even
your
know that
eyeball.
was there.
You're like, ugh. You flip it this way. I know. Here we go. Now, I warn you before I adjust you.
Okay.
There's no surprises. Okay. You know every step of the way. I like to talk. I tell you every step. This is that, okay? Here we go. Here it is.
Oh.
Yeah, there it is. Hi. Right there's a lovely little knot.
I can feel it all the way into my lower back.
Yeah, well, these are all attached. In fact, the upper neck feels great. And that's great. And then we get a huge knot right there in the lower neck. Oh my goodness. Okay. It's not the scalenes. It's not here. Right here in that gutter.
Okay.
It's
Oh.
right where the bones meet on the back of the neck. That's where all the nerves come out.
It's insane because I can feel it like pinch all the way like right there in my lower back, like a tickling.
Yeah. So it's a little bit different when a chiropractor is going to get in here, because we have one goal: free the nerve. Free the nerve.
Free the nerve.
And then you're going to feel me come down into this. The neck's not going to feel completely right until I get this moving. But we will get there. All in good time. Oh, I'm sorry. It makes everything twitch. Here we go. Too much?
No, it's fine.
I can back off.
No, it's more than fine.
Me, you should see me when I get all worked. I'm kicking. And I keep going. It means it's working.
That's exactly how I feel.
right there. It's this little tiny, I am so going to show you the cadaver, what this is. You'll see it and you go, oh my God, that's what you're working on? Yes, it's a little itty bitty nerve that hangs off the back of the skull. Right there. Squishing that. There's a lot of fluid under there. Nice and easy, okay? Chin back. There it goes. See, this is what I mean about
That was
joint
so
play.
easy.
This is just joint play. Okay, that's all that is. I make it look easy because it is. When you know how to do it, right here, chin back. That sets the joint into position. And I don't have very far to go. Right, I'm gonna try. See, I did like a little half treatment and it's still swollen. So I'm gonna go a little deeper and get this one. If it doesn't move, it's no big deal. Right here? No. Okay. That's what I mean by like just trying it and testing it out. Chin back for me. Wee! Very nice. Oh, that should feel better.
Mm-hmm. Whoa.
So now the skull rocks not under. Like your bones rock under your skull. There we go. That's what I meant to say. Now, how does the jaw feel right now?
Pretty, I mean, it feels fine.
Jaw's not in too much pain right now. Mm-hmm. Okay. I'm just going to test it so I know where we're going before I smoosh you. Okay. Just open up your jaw for me. And close. And open. And close. It's all this side, huh? And open. Geez. Hold on. Close. Open again. That's both. Okay. And close. Yeah. You can relax. I don't see any kind of directional. It's just a straight drop. This is what I mean right here. This is what you do. Is that too much?
No, it's fine.
Okay, so I'm going to teach you. I'm going to usually sit you up afterwards, and I kind of come in here. We massage that one down, down to the angle of the mandible here. That one, massage that down to the angle of the mandible. This is an attachment right here.
Okay.
Okay, we get these two attachments. That's what this one's for when she's doing this one. It's to push the upper part back down. Same idea as the skull. That's how I work. I'm just squishing fibers back into bone. Pushing it in. The rubbing is like to get blood in there.
Okay, so just more focus on the squishing?
Just squish. Okay, I'm going to come back to it. She has a foot aversion, so she's way over there. she's like, she thinks they look funny.
They do, I understand.
A little stuck over here. Ooh, not anymore. Ooh, baby toe. Yes. I don't think I've ever cracked my baby toe. Today's the day. Ooh. Crunchy. Definitely putting weight on the middle part of your foot. Ankle. Okay, I'm going to slide you down the table. Just relax. Good. Excellent. Ooh. There. Come on. There we go. Any pain in the low back when I do this? Perfect. Nothing there. Relax here. Good. Relax here. Perfect. Bend. Any pain in the low back? Good. Okay. Come on and sit up. You're going to just test the neck. We're not done. I just want you to look right and left. Take a little break. Okay?
Oh,
A little smoother. Just make sure your face isn't touching either of these two pieces of wood. You're going like right there. Ooh, real tight, huh? Ticklish? Or
Yeah.
is it just ticklish?
It's ticklish tightness.
Well, tickling is the predecessor to pain. Same nerve.
Oh, I did not know that.
So it's the same nociceptor. Okay, just scoot down a little bit for me, just a tad, so I don't want to push. I'm not hurting you. Okay. How's your face in there? Is that okay?
That's doing fine.
Jaw's okay? All right. So here we go with the cracks, okay? Some more pop. All the way out. Let it all out. Oh, that's it. You did it. couple more, okay? Deep breath in. And all the way out. There's one set. Deep breath in. Oh, wow, it crunched both sides. You doing okay? Ooh, except for that. All right, I'm gonna clip this to your pants now, just to hear. Oh, sorry. Pants. Oh, sorry.
I don't know what it is.
Right there,
like
right there.
my lower back right there. is
Okay.
super, like,
Now I know.
Just like involuntary. Like,
Okay,
like,
I will
I'm
warn you
so
then
sorry.
when I. No, you're fine. Take a deep breath in. How about here? We're good? And out. There we go. Perfect. Good. Relax. Whew. Oh, sorry, I'm touching the mic again. Touching the mic. Moving it up here. What I am going to do is test the skin on the back, though. I'm going to try to do it, if you're okay with it, I'm going to do it as fast as I can so that you can just relax and then there won't be any more of it. So I'm going to grab here. That's all there is. Good. Hey, your upper back moved really good.
That's good.
She's mostly like upper back right here. Are you good there where you are? Do you want to move it or do you want to switch? Do you want to do anything? I'm just asking. All right, so here we go. Oh my goodness. Is this okay when I push like this? Okay, here we go. This should be kind of more stuff that you're used to, hopefully. I just always go in there like that. Okay, oh, we still got some. Take a deep breath in again. All the way out. That's about as hard as I'd like to go, but is that okay?
Yeah. You can go harder if you need to.
Okay. Drink lots of water after this, as I'm sure you know.
Oh, absolutely. Flush it all out.
Yay. I mean, that is really rock solid over there. Okay, here we go. I'm going to go in this corner. Sorry, I'm just going to move this. Right here along her end for spinatus. Right in there. Oof. Well, maybe this is part of it, eh? You okay?
You're hitting all the spots I've ever wanted to be hit. So I'm like, yay.
Oh, chiropractors are real good at that. Like, oh yeah, there's one here. Oof. Man, I'm not quite at the right angle. Hold on. I'll get it. Ah, I gotta pull. Now it opens up. Sorry.
You're fine.
Here we go. Shake, 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 shake. Oh, good. Down. Oh, what a difference. Perfect. Gotta do the same thing on the side. All right, taking a break here. Whee. Oh, okay. About backed off. I'll back off. There you go. Got to figure out which way it wants to go. get it. I'll get it. I promise. You doing all right?
Mm-hmm.
Okay. Maybe we'll go this way with it. One way or the other, it'll yield. But this is like pretty stark here on the underside. Okay. All right, got those. Now, I'm going to use my elbow and just kind of run down here.
Okay.
Like that. Oh. Yes, no.
Mm-hmm.
There we go. Breathe. There she goes. Okay, take a break.
Oh my gosh.
Low tables.
You got that moment. Like the angle and everything.
Low tables help. Oh, you got another one right here. Oh.
I do bruise easily, but I do not mind bruising.
Okay. A lot of women do bruise easily. It's just like kind of how we are.
We're all a little bit anemic.
Just a little, yeah. I mean, I take blood builders and it helps. I'll start turning yellow if I'm too anemic. Literally. Like, whoop. You tasted more of that liver. Don't want to do that. Skin looks great though. You know, I don't see any lesions or anything like that. Nothing looks dangerous. Everything looks good, healthy. You're actually not bruising as bad as you think.
Really?
Mm-mm.
Dang. I was hoping to go home and be like, honey, look at my back, how cool it is.
I mean, you have it, but it's not like horrible or anything like that. Okay, so let's do the neck. I want to come back to I would say I come back to it. Oh, there was a little one. I'm going like all along the angles of the muscle. This is muscle work, and as far as I'm concerned. Like that. Is that okay?
Mm-hmm.
Look up for me again. We're doing the opposite and then back down. Perfect. You okay?
Mm-hmm.
I'm really gonna pull. This all connects into the jaw as well.
Is that okay?
Mm-hmm.
Just seeing if there's any adhesions. Oh, it feels great. Oh, this is the one that's... I have to kind of go along this line here for the nerve here. Yeah. Good. Okay. Just push. This is a suture right here, like a crack in the skull that everybody has, where they came together when you were a baby. If you felt like the back of your, is this little boy that you have? Your son's head, you would have felt that open at like until it closes about 3 months. So we try to keep these all flexible. Keep them moving. So I'm going along that ridge here. I'm sorry, you got another one over here. Oh, hello, I almost missed it. There's another crack in the skull here. Okay, just so you know. It feels good to keep those sutures moving. Or flexing, I should say. There's another one here. I just keep feeling the jaw.
I know.
All right. We'll get there. Okay, yeah. If you want to come on up. I know. Here, we'll give you
That's
some.
wonderful.
I'm just checking all those little cracks. Oh, your makeup like stayed in place.
Did it? Oh, yay!
How'd you do that?
I don't know.
Okay. It looks a little worse in the picture.
Oh my gosh, it's so cool. It's beautiful. I'm sorry, I'm really weird about it, but I just like the pattern of it. Like, I don't know. It's like a galaxy.
You can kind of see where
Oh yeah, I see.
little baby ones on there. Not as bad. Really, it did come out a lot in that upper back.
Oh good, yay.
Okay.
It's weird because it's just like this, like, you're the first person ever to tell me that tickling is like a pain thing. Because I always see it as like this, like, but like,
Well, you know.
it all goes right down to there, like a little pinch right there. So I never knew it was like.
I mean, it doesn't always mean that we mentally interpret it that way, but it is what it is, right?
I'm like, huh?
Yeah. So lean away. We're gonna do the ears. Lean away. Whole body. So there's the ear. Good. Nothing on the top. Just a little bit on the bottom there.
This ear crunches a lot, just routinely, just all the time. I go like this.
Well, it might not after I adjust it. I don't know. Lean away.
Ah.
No, nothing there. But it did move. Cool. All right, so I'm hoping that's there. We got that. Let that calm down before we do the jaw. Jaw is like the final spinal. Okay, and then there we go. Oh.
That was amazing. I felt it all the way down.
See if she can let me do that one. Okay, perfect. Other side. Like, let me get it. Okay. Yeah. You're not gonna fall. I got you. I am gonna roll you to the edge though. Okay, there's the top part of the sacrum. That's all she goes. That's it. It's that one little one. I think we got a lot of it on the other side. Bend both of your knees. Okay, this is the pubic symphysis. You have a joint in the groin area, where the legs come together. It's the shelf of all of your organs. All the organs sit on top of it, and during pregnancy, you might have felt it in there. So that's the one that I like to pop in the front. My hands stay here the entire time.
Okay.
To there, good. And then you're gonna squeeze. More. There's one side of it. Perfect. Now squeezing in. Squeeze. Harder again. There, that's it. Perfect. That was it. Only one side wanted to go, but that's fine. That means that that's all that's there.
Okay.
This is just a warm-up, okay?
Mhm.
So again, it's the same kind of thing. Now, the buccinator, and when you hear that buccal massage, is more this cheek that puffs out your cheek. That's not what I'm going for. I'm going for the masseter right here, because that is in control of the TMJ. Here we go. You doing okay?
Mm-hmm.
I gotta go all into the face. I'm gonna flush this down. There you go. I do have to lean you a little bit against me. You okay? Just
Mhm.
kind of relax. Is it painful?
No,
Okay.
I just know it feels so stiff.
Okay. Draining this out. Taking care of the glands first. Get that out of the way. That'll take a lot of swelling out. Ooh, crunchy. Perfect. Now just relax. I'm gonna go down the throat here. Just kind of unlock that. Down the clavicle. This is where it drains, right into here. Lymphatic duct is boop, right in there. Especially on the right hand side. This is where it dumps into right here. And for that reason, a lot of people are more congested on the right, if that makes sense. So I'm just gonna open this path up. So the thoracic dumps normally on the left hand side, it's all centered in the middle. On the right hand side, just this region and arm. It's right here. I know, don't ask me why the body did that. Very lopsided. So everybody's always like, oh, why is this so sore? Well, lymph drains into here, into the armpit, all that. There you go. I've had even when your friend with the massage, she can go up into here.
Mhm.
I usually can't film all that because it's into the breast tissue, but all of this.
Oh yeah, that would be so.
Yeah, you need that pushed through.
All
every
drained and everything.
Yeah, so have her come up and do that, because I did
Okay.
feel on the back you're a little congested. You can do it in the shower too. You just kind of.
So do you want to just always be going up and then from here down into it,
It
into
doesn't
the trash
really
can?
matter, but yeah, there's there's 2 trash cans. You can kind of
Yeah.
think of it like that. Yeah, there's this, that's why our armpits stink and all that stuff. And then we put deodorant and we clog it all up. It's don't do that.
No.
But anyway, yeah, you're putting, you're trying to dump it towards the armpits, but you can also dump it into here. It's just basically, it shares. There's watershed areas. So it's a plexus. It's like a network of lymph tubes. It's not an exact science. You just try to kind of squeeze that into these areas. Okay? Usually lymphatic work is very gentle.
Mm-hmm.
And you're dealing with just the skin and the lymph. Okay? That's what I'm doing with this jaw. I'm trying to get your jaw to kind of drain into here, down into here, because I don't want it to swell up and stay in your face.
Mm-hmm.
This is where we're going. So So we want to open up these channels. Make sure they're all free. You know where I learned that from? Was from an ankle being swollen. I would just work on the ankle, and I couldn't get it to drain. So then I worked on the calf, then it drained. It's like, oh, I have to like open up the channel all the way up the leg. It took me a while to figure that one out. I was like, oh, I have to open up the whole tube. We're just tubes. There you go. Okay, so I'm opening all this up. Do you have makeup on your eyebrow?
No.
No, okay.
Well, yeah, but you can leave it up. I don't care.
Oh, okay. It's just to grab it like this and pull.
I do this all the time when I have a migraine. I grab it and I just pull on it like that.
Yeah, you just kind of like grab and pull. Because there's little nerves, there's a little opening. You can feel the hole right there that everybody has. Little opening there. Like, you go ahead and feel it. That's a trigeminal nerve there.
Yeah.
The little dent.
Yeah, I feel that all the time. Like, sometimes with my acrylic nails, I'll dig into it and go right in there and be like, ah!
Yeah, you can like grab it like this and just pull. And then I kind of floss it and I wiggle it. Wiggle, wiggle. When you're having a headache, it feels good. You can always go into here. It's kind of, I mean, when I have a headache, geez, clawing at my head.
Mm-hmm.
I'm like,
A lot of like I'm gonna self-drain something, whatever I'm doing.
yes, I'm pushing and pulling. Because people wonder how the hair cracks in the skull. You can make anything crack. Doesn't mean that it's a good thing. But you're just mostly checking for anything to be stuck. So if I pull, but your hair is moving, so I'm not going to pull harder than that. But this is another place where people get stuck, up right at the crown. Ponytails and stuff like that they put here. But I don't feel anything when I was working on you. It felt great. So, final one is the jaw, okay? It's on your back. So I'm going to go inside the mouth, like towards the outside. Should I close the door? I think it's okay. Now see, here's the back part of that muscle, okay? And this is where it gets sore. Yes.
Oh.
I'm sorry. This is where it is, right in here. See that little band right there. 5, 4, 3, 2, 1, and give you a break. Yeah, that's the inner side of that joint.
Oh my gosh.
So you can go all the way up in here. It's usually right back behind the wisdom tooth. Right there. 5. Oh. Let me see if I can warm that up at all. It's not bad. It's just here. Okay, here it is. 5, 4, 3, 2, 1. Take a break.
Oh my gosh, I didn't even know there was a pocket there.
That's the inside of that joint.
Huh.
The joint is like linear, and you can just come on the inside.
Wow.
Okay. I know, the tears.
No, we're doing okay so far.
Oh, that's the one where I'm like,
I don't know if I'm like too okay with this. I'm like, no, that's fine.
you know, hey, if you're okay, there's always more, but eventually it gets like unbearable. You know, like you're like, ooh, I'm done. Oh, that's good. Hold on, I'm gonna find it. Okay, here's part of it right here. Just going in and massaging that. I'm going in blind. There it is. 5, 4, 3, 2, 1. Give you a break. Whew. I just hold here. Oh, there she is. There she is. 5, 4, 3, 2, and 1. Right there. Oof. Right in the back there. Here's, wow. Should feel a little smoother.
Mm-hmm.
How are we doing?
Doing okay.
Is it clicking at all?
It's like not really just this side now.
Okay. I don't know how much you want.
I
can check it. I'm not
Okay.
gonna. If I find something, I'll get it. But I don't. I just kind of poke around in that area until I feel it resisting. That's literally what it feels like. It's like a pocket of resistance, and you're pushing on it. And you just twist until it, and again, we're squishing it back up onto the bone.
Okay.
Okay. She's like, okay, okay. Oh, much better. There, feeling the muscle. Trace that back up into the corner. There's the corner. See, that's the inside of the joint right there. That's the inside. 4, 3, 2. You just wiggle that. No, there's nothing left. Feels good.
Yes.
Feels good.
Yay.
Now that's where you have to be in that state to let it heal.
Okay. This is all I'm going to be doing while watching TV.
Just make sure you really clean your hands.
Oh, yeah, absolutely.
This
No,
way?
you're just gonna sit up as straight as you can. You let me do it, and then once I get in there, now elbow back into it to my perfect.
Oh,
Yeah, that's what we were going for. Good. And then lean away.
So I think I'm like doing something in my
Well, yeah, I was gonna
Sweet.
say if you do this or
Mhm.
anything with the arm up,
Yeah.
that gives you one pinch,
Mhm.
and then you have another pinch back here that we got rid of. I just don't know how long it'll take before it comes back. It's usually about 3 to 6 months. So there's another crush back here. They call it crushes. I don't know why. It's called a crush. Triple crush, double crush. I don't know. So it can crush here, here, here in the neck, here, here, here,
Whoa.
here. So there's a bunch of places that it crushes. So it's not just the wrist. See if one of those other ones
It
will
could be
also.
any of those.
Well,
things.
they all
Oh my
stack
God.
up on top of
That's
each
true.
other. So the wrist brace is helping. The primary culprit is probably in your wrist. However, just know that there are other ones that you can seek out to help.
Okay.
Because this is the furthest down the chain.
So
It
it
all
could be starting up here
yes,
a little bit, a
this
little
is
bit,
the
a little bit.
that's right. So then one little thing, because you're supposed to be able to do this. That's the test. That's the test. How you test for brachial plexus problems. Yeah.
Like that?
Yep.
Ooh.
Yeah. That's a
Wait,
test.
can you make yourself a rabbit? No.
Yeah.
Oh.
Ow, that hurts. You have
Ow,
a problem.
you have a problem.
You have a problem. That's right. That's right. Oh, well, it's now changing. A blotchy galaxy now.
Oh, yeah.
Okay. So that's just like feel it with your hands.
My legs. I'm just so
Bend.
used to doing
You can do
that.
that or bend them like that.
In here.
Yeah. Now if you want to come off, you gotta roll to the side. No.
Oh, roll
Back,
this
back, back. I'm gonna show you how to. Yes,
Oh,
yes.
okay.
Just slide off.
Woo.
Wait, if you ever feel stuck. Yeah, go ahead. Feel it. Test it out. It's in the right position now.
Everything feels so much better.
Yeah, because now it's sitting correctly, so it'll feel like, oh, this is how my body's supposed to work. I remember this.
Oh, hey girl.
Yeah, yeah.
No, there you go.
Yeah, so that kind of thing needs to be done like every 3 to 6 months.